people come into this and it completely sideswipes them and their life is just turned upside down. I was given this opportunity and I thought it was a great way to help the people in our community that need a little bit of hand-holding during a really tough time.
Their mind's all over the page. They don't know where to start. We try to let them know they're not walking alone and give them the support that they need.
A Cancer Navigator's role is varied. I'm a resource to them, getting them connected with our support services through the Cancer Center, and then if a problem, a question comes up along the way throughout the process, it's my job to help them remove that barrier and fix that problem. There are 4 registered nurses, all Cancer Navigators, and we do divide the cancers by site. So I am breast and GYN. We have a thoracic navigator, so that's lung, esophageal. We have a GI navigator, and then we have a head and neck. We try to cover all the bases.
We have a common goal of trying to expedite care for patients, trying to make things simpler for them, trying to clarify, trying to just take everything one step at a time.
We do a lot of follow-up calls to see how things are gone, to see if there's any additional things they might need. Sometimes just being emotional support. We open up a lot of resources in the community that are there that the patients have no idea are even there. Transportation is a huge area of concern for the patients. Some of them don't even know that they have it on their insurance.
So we do have a partnership with Healthy Generations Area Agency on Aging that we use for transportation to help people that don't have other options. We have a financial counselor. We help people apply for Medicaid, disability. We just help them really with whatever they need. It's really nice that we have all these resources and I feel confident saying to a patient, we got this.
Some people, they really don't want to talk a lot. They just want the information, want to get plugged into the health system. Some people just need to talk and vent and cry. So I just tailor it to the patient. I always try to meet the patient in person, and we can attend appointments with patients. So we certainly can fill that role.
I'm a nurse navigator because I love helping people. Some patients, I am holding their hand from diagnosis until well after treatment. Other patients might just need a touch point, and then other patients I talk to multiple times a week. It really just depends on the level of help that they need.
They're so appreciative of our services, and even though they're going through such a hard time, I'm there to help them. They oftentimes lift us up and, are just super appreciative of what we do. Because they are free services, I think that really shows that Mary Washington is committed to helping our patients mind, body, soul.
Just knowing that these services exist, I think, is a huge resource for the community, and I think something that Fredericksburg should know that they're really lucky to have, that even if you do have the knowledge, sometimes just having a touch point to say, hey, am I missing anything? Is there anything else I should be doing to make sure I get this cancer taken care of? And that's what we're here for.
One of the things I love about my job is just the difference that I get to make in patients' lives. And this is a very scary time for patients, and if we can come alongside them and provide them with additional education, information, support that they need, it makes the difference in their lives, and it makes a difference for us.